Hi there, everyone. My name is Anne, and I'm one of the co-owners here of Active Health Solutions. And with me is Judy, and we're coming at you today from our studio in Prince George. And this is video 2 out of our series of 4. And this series of videos is designed to help women recovering from breast cancer surgery, either a partial or a full mastectomy. And this video, number 2, is for the 2 to 3 weeks post-surgery up until about 6 weeks. So we're looking at improving mobility, or that's going to be our focus. We're starting to get back to some regular movement. Hopefully you're starting to feel a little bit better. But still, just a reminder to go slowly and work gently. Work at a lower intensity until you feel comfortable and you're able to handle a little bit more. If you are adding weights, keep it under 5 pounds. That's the guidelines that Northern Health has put out in the breast cancer information that we've been referencing. And the equipment that you're going to need for today is something long and light. So we've got a hockey stick, for an example, a dowel. These you can buy at any hardware store. They're not very expensive, but you can also use a broomstick, a broom, or even a golf club if you have something lying around. So lots of options to pick and choose from, and keeping in mind that we would like you to work even with small movements. So you don't have to do the full range of motion. If something is hurting or something is limiting you, stop. Proximal movements is just fine, and we will work your way back up to feeling like you have a bit more range of motion and a little bit more mobility through your upper body. So we're going to get started. Judy's going to start doing our demos, and I'm going to coach her through it. And she's going to start with some walking patterns. So you can do this outside, down your hallway, in your house, in your living room, wherever you like. So walking, but swinging your arms, making sure your arms are starting to move and get a little bit warmed up. Okay. Then from there, after you walk, and you can walk, go for it, walk as much as you can. So side to side, so you're opening up a little bit. Also, you can, swing them across your body in different patterns, whatever you like, with little rotations. You can also, with your walking patterns, do some sidestepping. Okay, so that's important. So walking or shuffling or sidestepping, and even a karaoke step. So that's the front, back, front, behind, and she starts, oh, now she gets a dance move out of us. I love it. There we go. And you can add in some swinging movements as you're starting to do your karaoke step. So that'll be important to just get you heated up a little bit. Also, you can take the stairs in your house a few times. So if you have the opportunity to run up and down, or not run perhaps, but take the stairs a few times, that'll just get your core temperature heated up a little bit. Okay, and then after you've done that, grab your dowel or your golf club or your broomstick or anything like that, and if you can, join us for a few exercises. And again, I would like you to just pick and choose what works for you. We're hoping that this is about a 12 to 15 minute routine, and same with the first video is about 15 minutes. So whatever you can do, that's what you should do. And if you can do it a couple of times a week, that's even better. So starting with wrist flexion extension there. So again, we were sticking to last week between 5 and 10 of these. So she's just loosening up those wrists, activating her shoulders a little bit. And then from there, after she's done about 5 to 10 of those, she's going to do a little bit of rotation here. And now she's starting to engage the shoulders a little bit more. So that's excellent. So good rotations there. Then from there, she's going to do a few big circles. Okay, so however you want to do these, just moving them around. We're starting to raise our arms above our head. This is starting to increase our range of motion. So it's about 5, I think, in one direction. I've kind of lost count. 5 in the other direction. But that's okay. It's just whatever you want to get you moving here, right? That's just activating. You can make them small like I'm doing, and Judy's doing a bit bigger. No problem there. Then you're going to take your broom or your club or anything like that, reach it around behind your back. Okay, and then from there, you're activating down nice and low, and you're gonna pull those shoulder blades back and squeeze your shoulders. So using the club or the broom as an anchor point, and just doing a number of little squeezes there. So that's just moving those shoulder blades around. They tend to get a little stuck on us. So she's just doing these shoulder blade squeezes, and she's just trying to pinch them towards her spine a little bit. Then we're going to switch to external rotation, so it comes back around the front, hands underneath, and you're just going to open up without swinging your body. You're just opening on the one side. There we go. Move. There we go. Good. Sorry about that. We're just checking. We're not very tech savvy, but we're doing our best. So those are the external rotations right there. Then we're going to shift to an overhead press. So it's going over top, and do that a few times. And then we want to try and open up our chest. So our pec muscles, right? We're just up and then trying to move it even and even a little bit behind our heads. This one's a little tricky, especially depending on where we've had our surgeries. Looks good. That's a pec opener there with an overhead press. Now this one we were testing before we hit record, and it's a tricep stretch. So taking our broom handle and going up and over and trying to find it on the bottom. That's the hardest part of this exercise, finding it on the bottom. You got it. Hey, right on. And then we're just kind of going up and down ever so gently. So this gets the tricep muscle, and then when you pull from the bottom, then it's an internal rotation here at the shoulder. So it's like a saw movement, and you're going to go very slowly and very gently. So you're going to go down and up, and then you're going to switch hands. See if this is doable. We were muddling around with this one earlier. There, you got it. Well done. So the tricep and the internal rotation. So when we did this one last week, we were just reaching up our hand up our back, and now we've got an implement to do this, to try and increase range of motion a little bit more. Hopefully you're starting to feel better after your surgery. Okay, well done. Now from there, the next few exercises are more for mobility in our legs and just moving around and staying active through our spine and through our lower body. So they're not necessarily related to the surgery that you've had, but perhaps just with all the sitting and all the hunching that we've had to work through, this will help. So the first one is side bends. So we can even be up here, wherever you like, and we're just trying to go over to the side. We're going to do that a few times. Either side looks great. And remember, this one I find I could hold my breath. So making sure that you keep breathing. Don't do a big breath hold here. How many is that either side? I lost count again. 3. Looks good. Okay, let's do last one, either side. There we go. Now we're going to hip list. So holding it out, and then you're going to just lift up. And you're trying to ground and anchor one foot down and lift and pull the hips straight up. And this one, like our pelvis is supposed to kind of move side to side, and we're so used to having it like tucked under because we sit so much. So this one might feel very, like for a tiny little movement, it can be very tricky to feel it. So then after the hip list, so you're just trying to pull it straight up, we're going to do what I call is an in-out press. So you're pointing your toe into your other foot, you're pushing it, rotating it out, and then you're lifting it to the side. And hopefully you're activating a little muscle on the side of your behind. So I would do about 5 of those in-out presses.
Using this for your balance.
For your balance. Use the dowel, use the stick. You can even use a wall or a chair, works as well. but we're just trying to stay balanced. We don't need any anything else going on here. We're just gonna stay on our feet. And yeah, you can switch hands with that now if you want. It's all good. Works better. Good, in, out, press. Good posture. I saw you correct your posture because it's funny how we get concentrating and things happen. Looks good, in, out, press. And then we're gonna switch it to a hip hinge. So holding it out in front of us, and gravity's just gonna take it down, and we're gonna keep our knees soft, and you're gonna keep your back flat, poke your bum out, and you're just gonna hinge. So this movement is all from the hip here. And I would like to see even 8 or 10 of these, because this movement here, without hunching, so many people get rounded, and she's doing it beautifully with her hips poked out, her back nice and flat. This is a great movement here. Hip hinges. Hopefully you're untangling some of those postures where we're kind of crunched all over. And then the last one after this, is this number 8 maybe? Again, my counting is brilliant. Is going to be, you're going to step forward with it out on the outside of your one leg there, and this is a hip flexor. So you're going to go into a mini squat, and you're just going to come across into a hip flexor, and you're going to try and feel it in this front, this muscle right in the front of her hip. So you're going to kind of come up and down a few times, keep it moving. This is a nice dynamic stretch. I think that's 3, 4, and 5, and then she's going to switch hands and legs. And so other side, yep. Oh, we can fix it. It's all good. Carry on. Maybe some of our participants have done the same thing, and then up and over.
Is this
No, I don't think it is the other side. I think you have to. It's there. Now you're good. Now you're set up. And we do this quite a lot, which is kind of funny. I think that's 3, 4, last one, 5. Now I'm going to get out of the way because Judy's going to move over to the wall here, and she's going to show you a few exercises. We wanted to give you some standing options. The next video will be on the floor. So when you're feeling a little more gung-ho, you can get up and down off of floor level. So the first one that she's going to do here is a downward facing dog on the wall. So trying to get those hands up above, try and get her head between her arms, really opening up her pecs. Right above, feeling it in the lats as well. So that's that's like a downward facing dog in yoga. That looks nice, about 5 of those. And then she's going to bring her hands down to eye level and do another version of those shoulder blade push-ups where she's pinching and squeezing her shoulder blades to kind of come towards her spine. So we've done a few of these already in the various videos. Then she's going to switch to an easy wall push-up. Okay, so this might be a little bit more vigorous, but if you kick your feet out away from the wall, it gets harder, and if you go towards the wall, it's quite a bit easier. So again, pick your level. We're just trying to get some range of motion, just trying to build a little bit back at a time. So these would be some easy wall push-ups. So you can do 6 to 8 to 10 of those if you like. That's a good one. And then we're going to switch it to a thread the needle. So one hand up, and the other hand's going to swoop underneath. And this is going to be a little bit of rotation in the thoracic spine. So that's what we're trying to build into the spine. It's moving a little bit. So again, 5 of those on either side. And we'll give you some variations in the next video where you can do it from a tabletop position on the floor. Okay, I think that's the last one. And then we're going to switch it to a wall crawl. And we were having the conversation before that. So Judy's going to do it with her hand up the side. And she said this one was a really important one in her recovery, which has been about 1.5 years since her surgery. So she's got really good mobility. So depending on where you're at with your journey, right, some of these exercises might be more challenging. And it's just crawling your hand up the wall and back down. This is a really good range of motion one. Up and down, up and down. So she's doing this a few times, the wall crawls. You can also do it face on, right? You can face the wall and go up, but it's similar to our downward facing dog up the wall as well. And we do this one in class, and we use a mini band and walk up the wall. So we might show you that one in level 4 in our 4th video. And then the last exercise on the wall here is a pec opener. And Judy does this one in a door jamb of her house, but you're going to go with your hand up the wall at 90 degrees, and then you're going to step forward because it's going to open up that pec. So we're looking for 90 degrees, and then she's just keeping her posture up and stepping forward. And that's going to open up that pec muscle. So hopefully you're doing these a few times a day post-surgery. Looks good. Okay, so did you do both sides? Sorry. While we're being thorough. Okay, so there's her pec opener on the other side.
Which is the affected side.
That's her affected side. So this one's a little tighter, and she's had to work a little harder on this side. So she's doing a great job. And I wanted to throw one more little bonus thing at you today, and that's just a little bit of balance. Because especially after anesthetic and some other things that have happened, our balance we're finding might be a little bit compromised. So these are called windmills. So you can do it with a dowel, but you can just do it with arms. The dowel is hard because you have to put it behind your head. But even if we just use our arms, you're going to stagger your feet. Now, if your balance is a little wobbly, you don't have to have them in a straight line. You can have them staggered. But what we're trying to do is go both directions into a windmill. We don't want our shoulders to sneak up. We're just trying to get around in this windmill position. And this is really important to train our balance. And we hear from a lot of our participants at the studio how they're just shocked at how their balance has changed over the years. So it's really important for us to keep working on it and keep building it. Change feet. So you're going to do it both directions, and one side, right, the side that is open, you're going to find you have a lot more range of motion, and then with that foot forward, you're not going to turn as well on that other side. So that's when we start to hold our breath and we start to feel tippy, and so just keep working on that, and that's going to be just really great for you. So we want to thank you for joining us for this second video. I'd like to just point out that we do have a full mobility class. It's about 30 minutes on our YouTube channel, and it's called Restore, R-E-S-T-O-R-E, and you restore basic movement patterns, and there's a lot of stretching. So if you're feeling like you want to do a little bit more and you want to go a little bit more gung-ho, check that out, and we'll see you for video 3 coming shortly. Thanks.